thank you everybody for coming today. So we're going to be talking about evidence synthesis, and this is the first of two sessions that we're going to be providing to public advisors. I'm Sue Baxter, and I'm going to be presenting this session with my colleagues Fiona Campbell and Cantrell. So what are we hoping to cover in these sessions? As I said, we're going to be doing two linked sessions, and each one is going to look at the way that research studies are carried out in the Sheffield Evidence Synthesis Centres. So they're particularly the way that we actually do evidence synthesis. Other places, you know, might do things in a different way. So this is very much about kind of the way we do it here. And what we're going to do is tell the story of two different types of projects that we've carried out over the last couple of years, and really use those as examples to explore different parts of the review process. So each one of the sessions is going to kind of use one of these projects as a kind of a case study to actually work through. So what do we hope that you're going to get out of the sessions? Well, we hope that the sessions will give you a deeper understanding of what happens when and where in the evidence synthesis process, and that this then will help you to maximise your involvement in our research. We hope that you'll get an understanding of the different methods that are used to carry out reviews or evidence synthesis, which we hope might be helpful to you if you're looking at funding applications outside the centre, but also, you know, so you can keep a track of the stages of our work so we get through a project. We're going to cover a look at different terms and phrases, so we hope that this might be helpful for you when you're working with us to translate the plain English summaries into something that's usable for public audiences, but also, you know, so that you can really hold us as researchers to account for our use of jargon and terminology. We also are going to be looking at how review topics and questions are developed. And we hope that this might be helpful to you, again, if you're looking at reviewing funding applications in your other work, but also in terms of contributing to the process for what we do here in the evidence synthesis centres. So that's kind of what we hope that you're going to be getting out of the two sessions that we're delivering. So we obviously are hoping to get something out of it as well, and we really hope that by giving you more knowledge about the process, that you're able to challenge and question what we're doing, which will really maximise the contribution that members of the public make to our research. We're also hoping that by talking about the process and giving you sort of more knowledge about how it all works, that will sort of help us in thinking about how and where you are involved, and also, you know, where you should be involved in the process. You know, are we involving you as well as we could? You know, are there places that actually you could make more of a contribution that we haven't thought about? So we're hoping that it's going to stimulate some discussion. And as I mentioned, we're going to sort of think about words and phrases and things, which is going to be really helpful for us in terms of knowing which expressions are helpful or not helpful to use. And what we're going to do through this presentation is I've highlighted words in red that I think we would kind of consider jargon. So it'll be interesting to kind of discuss those and see, you know, whether actually they're useful or not useful. Okay, so what is the purpose of what we do? As I'm sure you all know by now, the job of our team is to carry out evidence reviews, which look for, bring together and evaluate research that's already been carried out in order to summarise what is known. And in that first sentence, I'm very aware that we very, very frequently bandy around the word evidence. So I think that's probably one of the terms or jargon words that we need to think about and describe a little bit more. So evidence is something we're going to be looking at as a term in a minute. So just to kind of give you a little bit of background on kind of how it all works, how actually the review products get brought to the centre. As you know, our funder is the National Institute for Health Research, or NIHR, and they do a long series of consultation with all different sorts of stakeholders. So they're trying to find out what people think are important questions to know about. So they do, talk to, the NHS, obviously public members of the public groups, patient groups, sort of all sorts of different stakeholders. And they then ask, what do you think is important? What do we need to know more about? So these kind of topics, and really they're topics at this point, come to us. And then it's up to us to develop some kind of focus and some particular research questions, really to decide exactly what we're going to look at. So it's very much a kind of a process of kind of going backwards and forwards. We've got this very broad-ranging topic, but we actually need to turn into something that's actually researchable. And what we end up doing, it obviously depends on the resource and time that's available. So sometimes we're told, well, you need to do this in 3 months. Other times they might say, well, you can have 6 to 9 months for this. So this will obviously determine a little bit, what kind of focus, what kind of questions we want to ask. But also we try and do as much stakeholder and public engagement as we can at that outset point. Really, are we asking the right questions? Where should our focus be? And then once we've actually delivered the review, it then goes back to the funder and goes out to stakeholders, and they use it in their funding decisions. Where should more research be funded? But also it's used for development of policy. So it sort of contributes to knowing things like, where money should be focused. Are there certain implications for research, implications for health service delivery? So it kind of is a cyclical process. It comes to us and then it goes back again. So as I said, we use the term evidence a lot. So I'm going to hand over to Fiona now, who's going to just talk through this slide and think a little bit more about actually what do we mean by evidence.
Hi, my name is Fiona Campbell, as Sue said. Welcome to this session. It's really great you could join us today. So I'm a research fellow based in ScHARR, and one of the and I've been involved in evidence synthesis for the last 2 decades or so. And these are projects that we undertake in teams, and people like you are really important members of that team. So what do we mean by the term evidence? And evidence is a word that perhaps we're more familiar with being used in a kind of legal context, where evidence might be a DNA sample or a fingerprint or an eyewitness statement. And they're all about actually supporting a truth or identifying a truth. In the context that we're talking about here, when we talk about evidence, we're talking about research evidence. And research evidence is a very broad term. And within research, actually, we think about different study designs, and study designs really are the tools of our trade. So the type of study design, the type of research that we use is very much determined by the type of question that we ask. And what you've got on your screen in front of you there is something called the hierarchy of evidence. And this sort of perhaps misleadingly implies that some types of evidence are more important than others. But actually what this hierarchy of evidence was developed for is understanding the hierarchy of evidence, which are the most useful study designs when we're asking questions of effectiveness. Now, when we're asking questions, we may be asking all types of questions like, what is the acceptability of an intervention? But if we're asking the question, does something work? And how well does it work? Then the types of studies designs that ideally we might want to use would be a systematic reviews, and that's one of the things that we're talking about today. Randomized control trials are also a very valuable tool, a study design if we're asking questions of effectiveness, but they're not always possible. And then as you can see in that pyramid, there are other study designs, cohort studies, case control studies, case series, and so on. These are all types of examples of study design. So when we're talking about evidence, we're referring to research evidence, and that could be a range of these different types of study design.
Okay, thank you. So I think you were just going to talk a little bit about the different types of review, weren't you, following on from those?
Yeah, so we use this sort of umbrella term, evidence synthesis or systematic review. And within that broad umbrella term, there are all kinds of different types of evidence synthesis. So systematic reviews, as I've just mentioned, and typically when we think about systematic reviews, we're often thinking about the synthesis of randomized controlled trials, which are answering questions to do with effectiveness. Does this intervention work better than that intervention? But we might also be wanting to do a synthesis of studies that have been qualitative, and those are studies that have been designed to elicit how people feel about what they think about something, and they really help us to understand perhaps why an intervention may be acceptable or not acceptable, or how people experience or interpret situations. Another type of review that you might hear us talking about are realist reviews. And these are approaches which really try and explore about the context in which an intervention is going to be applied. So it may well be that one intervention, say for example, a school-based intervention on uptake of a certain health behaviour, say smoking, might work in one setting but doesn't translate and doesn't work in another setting. A realist review will undertake approaches that really try and unpack the mechanisms by which an intervention works and help to determine, is that something that's going to work across contexts, and better understand how they work. And also another type of review that we do, and again, the type of review we do is in response to the question being asked, but also sometimes to the resources available, the timeframes of policymakers. So a rapid review will be something that we, for some reason, we need to actually speed up the process. So an example of those would be the types of reviews we're been having to do during the pandemic, where actually decisions need to be made very quickly. So we undertake rapid reviews where we try and speed up the process, sometimes circumventing the research process in order to produce a result more quickly.
Great, thank you, Fiona. So as I said, we're going to be using one example throughout this presentation, and we're going to kind of work our way through the different steps of a typical review that you might come across within the Evidence Synthesis Centre. So the steps of the review kind of go in a very particular order. So we start off with developing a research question and writing a protocol. Then we decide what studies are going to be relevant and look for research. We take out the important data from each of the studies in a systematic way. Then we put it all together, see what can be learnt, and then think about the outputs from the study. So we're going to be going through all these different steps in the process and just thinking about what happens when and why at each one of these stages. And as I said, using one of the reviews that we've done recently as an example. So first step in the process, as I said, is developing this research question. So I'm going to hand over back again to Fiona to talk about a particular review that we did.
Yeah, okay, thanks, Sue. So sometimes a review comes to us literally as a problem. And here's an example that came to us quite recently. There's a problem with student mental health. There's increasingly, people are aware of headlines where a student has committed suicide, or there's a survey which is showing that there's a rapid, here's two examples of them, a rapid increase in the numbers of students who are needing mental health support. So there might be a range of reasons why policymakers might be concerned about a growing public health problem, and this was one example. And one of the first challenges whenever you have a problem is to actually work out what is the reviewable question, and that may sound entirely straightforward, But if you've got a problem like student mental health, what do you think that the question might be? And any ideas from our attendees today? Don't worry if there's no ideas. If you've got any thoughts, just do unmute yourself. So if you've got there's a problem with student mental health, what might be the question you might want to know the answer to? Anna,
yeah, I think questions I'd ask is what is it that's raising the question in the first place? So so what's the indicator that there's a problem with student mental health? I think you'd look at what the possible causes of it are, and sort of the increases that there's been, if it's located in certain areas, as opposed to across the board. That's some of the questions.
Anna, thank you so much. And what I think I probably counted about 4 different research questions there.
Yeah, and I think Stuart, did you want to come in as well?
Yeah, I think Anna just mentioned part of like what I was going to ask, because I was going to say we would look at what is the prevalence of student mental health, like mental health difficulties within the student demographic or population.
Fantastic. So I think that's. I think together you've probably come up with about 4 different questions there. Why has it become a problem? How do you know it's become a problem? How big is the problem? What is the cause of the problem? So already you've got 4 different questions. And so actually right at that beginning stage, one of the things that's really crucial is that we work out what is the most important question here to answer. And you might have also said, well, actually, what I'd be interested in knowing is what are universities doing about it? Or what could they be doing about it? Or what are the best way of delivering mental health services to students? So there are all kinds of questions that you could potentially ask. And one of the first jobs we have to do is work out what is the question we should be asking. And that is an important process, because you don't want to answer the wrong question. You don't want to answer a question and then go back to your policymakers who've commissioned the review and say, actually, this is the question we've answered. And they say, actually, that's not the thing we're interested in particular. So that process of working out what is the important question when you've got this big problem. And actually what we decided to do is we picked this particular question, and you've both mentioned this. So what are the factors? So what are the causes? Now, quite often, and I've mentioned that we talk a lot about effectiveness. So the reason we didn't look at effectiveness of a particular intervention was because that had been a review that had been recently done. But there was no reviews that had been looking, what we use this term, upstream. So before people need the intervention, what could you be doing to stop them getting to a point where they actually need the intervention? What could we do to prevent poor mental health? What can we do to strengthen mental well-being? So that was the focus that we adopted. And whenever you're involved in the review process, always bear in mind that there are many different questions that could be asked. And it's really important that we get the question right at the beginning. So this is the focus that we took. We didn't look at interventions. We weren't looking at what services were being delivered. But we wanted to understand better the causes. So that was the focus that we adopted. And we kept it just to the UK, because that's the context within which the findings would be applied.
Fantastic, thank you. So that's sort of a really good example of how we actually start to get this topic into a usable question. And I think sometimes sort of people kind of wonder why we've kind of gone down an avenue, and hopefully that sort of explains it a little bit more. So once we've got our research question, the other part of deciding how the review is going to be done is actually deciding what's going to be included and what's going to be excluded. So what's in and what's out of the review. So as I'm sure you're well aware, I mean, there are thousands and thousands and thousands of research papers around, So actually trying to narrow down what we actually want to look at, what's important, which ones are giving us the answers to our questions, is really important. So we use, you'll have heard us using the terms inclusion and exclusion criteria, I'm sure, quite a lot. So basically this is trying to decide before we start the review, who do the studies need to have in them? So what's the population? So who should have been in the research? Is it young people? Is it older adults? Is it people from minority ethnicity backgrounds? You know, who do the studies need to have? What countries might they be from? As Fiona said, in the review we did on student mental health, we only looked at studies from the UK. So sometimes literature from around the world, sometimes it's relevant and sometimes it's not relevant. So we have to think about how applicable is some of the research that's been done around the world. Actually, you know, does it work in a UK context? You know, is the health system in the US so different that actually the findings aren't really that relevant to us in the UK? So thinking about what countries, what dates, you know, should we go back a long way and look for research? You know, is that actually going to be a bit out of date? Does it still have relevance for us now? Is the research providing answer to the right question? As Fiona said, you know, we spend a lot of time trying to get the question right. And sometimes the studies aren't quite answering the right question. They actually might be answering a different question. So again, we need to think about, you know, where are we going to pitch it? Which studies do we actually need? And then are they the right type of evidence? As Fiona has said, we look at the evidence hierarchy to think, well, you know, do we only want the very highest quality studies? Do we want qualitative studies? Or actually, you know, do we want a much broader range of evidence? So getting this inclusion and exclusion criteria right at the beginning, again, is a really important part of actually getting the study started. So I'm going to hand over to Anna now, who's going to talk a little bit more about how we actually look for the research.
So once we've got our question and thought about our inclusion exclusion criteria, we do some searching, and we search on the electronic databases. These are basically have lots of journal articles in them, and it just means that we can search them online, and it's a quicker. Obviously we couldn't look through all those journals like in the picture, but to look for relevant articles, it means we can search for them, and it's just a bit easier. We put in terms around our population and to help us find them. We use a range of databases for most questions. If you look at the pie chart, that's for some of the different databases we used in the mental health review. Medline covers a lot of medical literature, which was obviously relevant, but then also for mental health, psychological literature is useful, so PsycInfo. And then also there was relevant information from the social sciences, so ASIA and the Social Science Citation Index. So that's where we use a range of databases to try and find all the relevant research. And once we've got all our references, we'll put them into reference management software like EndNote or something, because that means we can take away any duplicates, because although the databases are great, they do cover sometimes the same journals, which means we can end up with duplicate references. And then for our search for this one, we got about 6,114 citations or references. And then we sifted through those to decide which ones were relevant for our review question. And that can take quite a while. And we'll go down from, say, the about 6,000 to I think there was about 40 included in the mental health review. And some of that will be done in terms of titles and abstracts, and then the full text at the end. Additionally, we would also search for grey literature, and grey literature is in unpublished reports. And for that, we would look on organisations or charities related to the topic. So for the Student Mental Health Project, I searched the Mind website, Mental Health Foundation, and other relevant ones that also did a general search on Google. And that's a way in which you could advise us, you know, on any relevant organisations or charities that it might be useful for us to search. Grey literature would be used in the review as the same way as our articles or citations, and we would assess it in the same way for inclusion, exclusion. And sometimes also reports can be used in the background, which I think some of the reports we found in the grey literature searching for the mental health project, they were able to be used in the background. Sometimes you might come across case studies that could also be used in the review if they met the inclusion-exclusion criteria. Once we've got all our included references, the included citations, I think there are about 40-ish for the mental health review. Another way to just make sure we've found all the information is citation searching. And that's when you look for any articles since your included references that have included them. So for each of the different citations, we'd search on there's different databases that allow this. And it just helps us look for other research that might be relevant, just to try and make sure we're finding all the relevant studies and cite any relevant studies that come up from the citation searching. Again, they would be sifted against the inclusion-exclusion criteria to decide which ones are relevant for including in the review.
Fantastic, thank you. So the next stage in the process is where we actually start to look at every single citation or every single reference, every single paper, every single report, and try to systematically take out the important findings from that study or the important data. And this is the process of data extraction, which can be actually quite a long and quite a painful process, as indicated in the photo. So we literally laboriously go through everyone. We develop what's called an extraction table. So this we decide this in advance and decide which particular pieces of information we're going to take out from every single study. So typically it'll be things like study author, the date of the study, the country that the study authors come from. Again, we'd probably take out the type of research, so which study design was it, and then who was in the study, so details of what the sample size was, so how many people were actually studied, who were they, were they people aged over 60, were they young people, and then also what did the study find out. So for every single study that we think meets our criteria, we'll go through and take out systematically the data from each study. So that's the data extraction process. And then we get into the next stage, which is where we try to put all the study findings together and compare them with each other. So this is the process of what we would call synthesis, which is where obviously the term evidence synthesis comes from. We're synthesizing all the evidence together. So we're putting them together and trying to compare them with each other. Did you want to say something about quality appraisal, Fiona?
Yeah, very happy to. So a really important part of the synthesis process is where we do a quality appraisal of the individual studies that we're including. So if you imagine that a synthesis is a little bit like a fruit smoothie, and you're putting your beautiful strawberries into your fruits, into your smoothie. If you chuck in a few rotten ones, you will you'll spoil the whole smoothie. So what we do in a quality appraisal is we try and find those studies which may have been biased. So bias is the equivalent to a rotten fruit in research, and we try and identify where we've got that rotten fruit, where we might be introducing bias, and we've got different ways then of trying to look and see what effect that's having on our overall findings. So that's the process of quality appraisal. It's really integral to our synthesis process.
Yeah, fantastic. And here we often use checklists and different tools to actually help us judge how trustworthy are the results and how well the study was done. So often you'll hear us use different checklists like CASP, which is often a checklist we'll use for qualitative studies, and said for each study design in that hierarchy of evidence, there's a different type of checklist often that we'll use. and sometimes we kind of try and bring them all together and kind of weigh up how much evidence there is, you know, regarding particular elements. So as Fiona said, that quality appraisal is really important. So once we've kind of put all the studies together, the next really key element of the process is really trying to work out, well, we've put all the findings together, we know what the research says, but what actually does this mean? So what can we learn from having done all this process? And this is really important element is sense checking what we found out with our stakeholders and also with public advisors. So, you know, what does all this stuff actually mean for the public, for health research and for health services delivery? So I think you were just going to talk a little bit about how this worked with the student mental wellbeing review, I think, Fiona, weren't you?
Yeah. Okay, so we used our stakeholders and our public advisors right the way through this review process. One of the challenges we had with this, so I mentioned a few slides ago that we were looking at some of the causes. Why was there this increase in students with poor mental health? What were the factors that were leading to poor mental health? And what also were the factors that strengthen mental well-being? And one of the limitations of the research that we had available to us is it only can tell us about what's measured. So a really important question that we went back to our stakeholders was, this is what we found, these are the factors we found, is there anything that you think is important that isn't appearing here, that it hasn't been measured? And we created a kind of framework that we used to identify factors that were pre-university factors, so things that might be relevant before a young person goes and transitions to university, things that happen at the transition stage, things that happen at university. So we broke it down to look at those stages, and we used this visual very much with our stakeholders and asked them to input into it and to identify what they thought might be missing. The other thing that we did as well was just to sort of use these kind of models and say, does this model help? Does this visually help represent our findings?
Yeah. Thank you. Yeah, that's really helpful. So yeah, so there are kind of other ways really that we try and describe what it is that we found out. So I think some of the projects that some of you will have been involved with, we've been using other types of visual imagery, plain English summaries, which, you know, our public advisors have a really key role in helping us to develop. Obviously, we do publish reports and academic papers from the work, but we're really keen that our findings don't just aren't just directed towards an academic audience, but actually, you know, are directed towards other people as well. So we're very keen to pull out what the implications are for health and social care, but also implications for research. So again, I think this is a key area where we really are seeking help from our stakeholders, including our public advisors. So were you going to talk about just how we sort of used vignettes during the student mental health review, I think, Fiona?
Yeah, so one of the things that we added to our report were some particular stories, because one of the problems with looking at factors is that they can all become a bit disjointed, and actually the reality is that quite often it's a combination of factors happening that may be all coming together in particular ways. And we felt that stories actually very powerfully conveyed that and described how it might be a multiplicity of factors and how they might interrelate, that conveyed that better than perhaps some of the very simple sort of linkages we were showing in the text and numbers that showed the strength of the relationship. But the stories were very powerful in illustrating the way that those factors interrelated with one another. So those were built actually into the report itself.
Yeah, so I think that's sort of another way that again is just really helpful to have stakeholder input in it, and they said it just, you know, helps with telling the story of what we've actually found out within our research findings. So that's another option. So we're always very keen to think about how we can do different communications for different audiences, because we're very well aware that you know, different types of messages work better for different kind of end users. So that again is something that's really important for us to think about. We're other options. We tend to always produce an evidence briefing from our studies, and I think some of you might have been involved in some of these. This was an example that we did from the student mental health review. So this is like a 2-page evidence summary or evidence briefing, and also you know, using short videos and things like that as well can be useful for getting the word out. So summing up, so what we've hopefully covered in this session is what happens when and where within a review, methods that we use to carry out a systematic review of the literature, different terms and phrases that the reviewers might use, and hopefully a bit of an insight into how topics and questions are developed. As I said, this is the first of 2 sessions, and this one was very much on a traditional, what you might call a traditional systematic review. As I said, our second session is going to focus more on a realist type of review, which will give you hopefully an understanding of that method and really how that differs from what we've talked about here. So we were just going to sort of end the session really with asking whether anybody's got any particular questions that they wanted to ask, or comments. Said you're welcome to use the chat function, or if you're happy turning on your mic. So are there any questions? Is there anything that we can sort of tell you a little bit more about from these slides that we've presented? Yeah. Anna, did you want to comment?
Not really questions, just to say that I think it was really comprehensive, and it's interesting to see certainly the last couple of slides on how you engage the public and stakeholders in the research, because having just come out of a master's, I'm not sure that is covered in any, it certainly wasn't covered in any detail. So all the systematic reviews and all the process up to that point is, but the engagement of the public and the stakeholders in looking and testing the research wasn't so much. Having said that, it was COVID. It was a COVID taught masters, so it was not your usual process for lectures, etc. So, but I thought that was really interesting.
Yeah, I think it has said it. I think it's sort of a growing area of research. I think research has sort of understood more and more that, you know, it's about delivering messages to everybody, not just about kind of getting a paper published. It's sort of thinking, well, you know, how can we use the research? How can we get the findings known about? So thank you. That's really helpful comment. Did anybody else have any questions? Was there anything that anybody needed clarifying? Or
for me, it's not really a question. It's just a comment. Well, I think it's especially a question. Like I'm just wondering how I can get more involved in, because I know I'm a member of the public and I'm a patient as well. So I'm just wondering whether there'll be more opportunities for us to get involved in this kind of sort of work.
Yes, yeah. Well said. We're always doing lots of different topics. So sort of as we're you know, new topics are coming through, we're always kind of sending out requests to members of the public to come and help us. So we tend to use the People in Research website quite a lot to advertise opportunities. And also if you're sort of already working with us within the centre, then we usually send out new opportunities to people on our mailing lists. So yeah, as new things are coming through, said it's worth keeping an eye on People in Research, but we do try and email to everybody that is already involved with the centre. So hopefully you can be picking up new opportunities through that. Yeah. So hopefully, if that's covered Any questions? As I said, we're just finalising the date of the next session, which, as I said, is going to be using quite a different review, which was actually using realist methods. So hopefully that again will just kind of give you some insights into a slightly different approach to actually doing evidence synthesis. But thank you everybody for tuning in today, and we hope you found it interesting. And that we'll look forward to working with you on our other projects in the future. And said, if anybody has got any comments that they want to email me about the presentation afterwards, please do. You know, be really keen for your input. But thank you ever so much for coming today, and we'll look forward to speaking to you soon. So thanks everybody. Take care now.
Thank you.
Thank you. Bye.